Providence Little Company of Mary Hospital here in Torrance has added a groundbreaking medical resource to their training tool that brings real-life scenarios to the operating table. Julie Parton has the story.
There is a new kind of training that the medical industry is beginning to use, and it's making life-saving differences.
70% of medical errors are a breakdown in communication. If you have nurses and physicians and others teaching together, training together, learning together, you're going to have better outcomes for your patients.
Clinical simulation involves lifelike patient simulators that breathe, display symptoms, and actually respond to treatment. Most of the scenarios are taken from real-life patient cases.
When the faculty goes into the control room, they adjust the mannequin to do different things. It might be to speak, it might be to stop breathing, it might be to increase his heart rate.
Providence Little Company of Mary applied for and received a $950,000 three-year grant from the UniHealth Foundation. With the funds, they built an innovative new lab where doctors, nurses, technicians, and even volunteers train together in the facility and debrief afterwards.
Simulation is very anxiety-provoking. You're performing in front of your peers. You have no idea what the scenario is going to be, which is very realistic, similar to patient care.
Over 1,200 physicians, nurses, and other staff will have the unique opportunity to participate in the ongoing training. Success is based off of improved teamwork, communication, and developed leadership skills.
Providence Little Company of Mary is the only standalone community hospital we've been able to find across the country that's doing this kind of work. So it's very unique for this size hospital.
Simulated hospital situations run the gambit and include frequent and rare cases such as stroke, heart attack, and hemorrhaging.
My hope always is that we are prepared for any type of event that occurs.
While the program is new and still being implemented, medical professionals who have participated in the lab are thrilled with the results.
This will help the communication of the healthcare team and thereby improve the patient safety.
It's really about the patients, always, when we're doing simulation. What is there, if anything, that we can do differently or better?
Clinical simulation is expected to become the standard of excellence in the medical industry over the next few years. I'm Julie Parton for This Week in Torrance.
Thank you, Julie. In a recent study by Thomson Reuters, Providence Little Company of Mary was named one of the nation's top 100 hospitals with intense training like the simulation lab. There's no doubt it will continue to lead the way in medical care.
California is leading the way in making history with the passing of a new law that protects mothers and